All right. This is kind of a multi-part lab here. We're going to be working with a couple different specimens. First thing we're going to want to do is head to the back of the lab. You're going to use a new set of brains. There will be other brains on the tables. Those are the med students' brains. They're probably pretty beat up. The ones that you'll want to use will be on a central cart, and each bucket will have a full brain and a half brain in it that you can use to do your dissection. So first things first, I would say just pull one of the brains out of the bucket and just familiarize yourself and get comfortable with the basic anatomical sections, the cerebrum, cerebellum, brainstem. Turn it around from a bunch of different perspectives, get a sense for all the weird, irregular little spaces and places in the brain, and just start getting comfortable with that. That'll probably be as good a place to start as any, just to get your bearings. What we're going to be working on today is a combination of goals. First, meninges, looking at layers on the brain. Dura matter you've already seen in the skull. There may or may not be dura on your brain specimen. There will be arachnoid matter, which is going to be that sort of semi-opaque, thin film that covers up the brain but doesn't go down into the sulci. So on the brain that you're working on, you're going to want to remove all of that arachnoid matter so that you can see all these little arteries in the subarachnoid space. So start out with something along those lines, removing arachnoid matter. Pia matter is actually on the brain surface itself, so you won't be able to peel that off as a layer, but that should be pretty quick work to identify those areas. I'm going to then quickly just try and move this section of brain over. Oops, not quite that much. And just look at the half section here. This is a little bit messy because of all of the arteries that are present, but this is where you're going to do your work looking for the ventricular structures. The space that we're looking at here in the middle, right in here, is all third ventricle between this thalamus and the thalamus that we're not seeing, the one that's over there. So this midline space is third ventricle. If I go up this way through this opening, there's sort of a hole up there called the interventricular foramen, and that will connect me up to the lateral ventricle, which is what's behind this septum. And then if I work my way downward through the cerebral aqueduct or mesencephalic aqueduct, this goes through the midbrain and heads down to the fourth ventricle, which is this space here between the brainstem and the cerebellum. So you should be able to identify these things relatively easily. You may or may not have a clear aqueduct based on the section of your brain. If it was off section, you won't see the canal because it's right down the middle. But have a look at these ventricular structures and identify the related anatomy while you're at it. We'll have another session on brain anatomy, but might as well do it while you're here. So that's going to be our the ventricular structures. Pretty quick and easy stuff there. Let's pull this all back together, and then we're going to work on blood supply. So I'd say start from the back end and work forward. You'll be able to find the vertebrals. They'll probably be cut pretty short. They certainly won't look anything like this long. But if you have longer vertebrals, you'll be able to see the posterior inferior cerebellar arteries, which branch from them and then go to the inferior surface of the cerebellum. If you follow the vertebrals up to the point where they join at the basilar, you'll also find the anterior inferior cerebellar, which are also supplying inferior cerebellum, but more on the anterior side rather than this one, which supplies more of the posterior. So that's your two cerebellar inferior arteries. The superior cerebellar comes off up at the end of the basilar and then works its way over to the upper part of the cerebellum. So this should be pretty easy to identify. This one may or may not be there based on whether or not the vertebral is present. But these two cerebellars, I'm thinking, are going to be pretty good. The labyrinthine artery might be kind of tricky. That one often gets pulled off, and it's in the internal acoustic meatus, so it gets pulled out when we remove it from the skull. But that's sort of the inferior end of the arteries. All of this kind of ends with the posterior cerebral artery, and we're going to look at that in a separate animation to see how that posterior cerebral passes from here to its destination. But I think this is kind of the main stuff for that. So let's pull open the posterior cerebral. Okay. Alright, so here's our posterior cerebral at the end of the basilar artery. If we pull some of this brain back, and you can do a lot of this sort of manipulation of moving the brain around to see these arteries better, because this circle that you can now see that goes like this all the way around, the circle of Willis, this isn't going to be immediately visible unless you push some brain tissue away, so feel free to move it around. But you can see our connecting or communicating artery, our middle cerebral, our anterior cerebral artery, and then there's a little anterior communicating right in there as well, connecting the two anterior cerebrals. So have a look at the whole big picture of the circle of Willis before you get too far. But then you can follow this posterior cerebral back, and you can see that it makes its way backwards, sort of in between the cerebrum and the cerebellum. And its ultimate destination is going to be more kind of in this area. This is where it sort of terminates and does all of its business, is in this medial part of the occipital lobe, inferomedial section of the temporal lobe. That's where that's going to branch out to its termination. All right, let's pull out the middle cerebral artery next. Okay. Back to the circle of Willis here. Middle cerebral is really the terminal branch of the internal carotid. So as the internal carotid makes its way up, again, you won't have this much of it. It'll be cut off about here. But if we move brain tissue out of the way, you'll be able to see again where internal carotid ends, middle cerebral begins, and it starts making its way, sort of burrowing through this brain tissue out to the lateral part of the brain, and it supplies like this huge array of lateral surface structures. So I think if I skip a couple here, maybe like there, this is going to give you a better sense for, all of these arteries out here are named. We don't need to know them all. They're just middle cerebral derived, but it sort of sneaks in through this lateral fissure and then just blows branches all over the place on the lateral surface. All right, then let's lastly look at the anterior cerebral before we get out of this brain business. Here's where our starting point is. Yes, yes. And then here is where our anterior cerebral is starting, and then heads up in between the frontal lobes. And I think this is going to be about all you need to see. You should be able to identify this pretty easily on your half brain straight away, this artery that's wrapping around the corpus callosum. This is a branch of the anterior cerebral. So have a look at each of these arteries where they branch from the circle of Willis, but also try and find them at their destinations, and that'll help reinforce your knowledge of where these arteries supply. Okay, the last thing we need to talk about before we leave the brain entirely is some key relationships of nerves and arteries. And there's just really a couple that you'll be able to demonstrate. The first is nerve 3 and the posterior cerebral artery, the superior cerebellar, and cranial nerve 3 oculomotor. They form kind of a tight little sandwich in there. You won't have this much oculomotor, it'll be cut off about here, but you should be able to see it coming out in between those arteries. And this is, again, right at the border of the pons and midbrain. The next is at the bottom end of the basilar artery with these two arteries that we mentioned before. The abducens nerve, or nerve 6. This, again, will be a little bit shorter than is what's seen here, but you should be able to see it passing right at that junction of pons and medulla. And if you have both arteries, they'll make that sandwich right around it. The last artery nerve combo that that you probably won't be able to find, but because this happens more often in the internal acoustic meatus, is the facial nerve and the labyrinthine artery. This is the artery that feeds the ear, and it goes in through the internal acoustic meatus, and you see it kind of wraps around this facial nerve. as it goes in. That can also be all three of these can be possible sites of artery nerve compression combination. So have a look and see if you can find those. There's really no reason why you couldn't identify all 12 cranial nerves today. All you really need is the atlas image and your brain to figure it out. So if you feel like getting a little bit ahead, go ahead and do that. The last thing you need to do today is just do a little bit of spinal cord work. And there's two types of things we're going to look for. One, we're going to be working on isolated cords in a bucket. And the second is that we're going to be looking at in situ spinal cords that are in a back specimen, where it's just really the vertebral column with a little bit of muscle around it, just to give it some context. And what you'll see is that the vertebrae, the back of the vertebrae can be removed, and then you can see the actual spinal cord laying in situ. This will allow you to see things that we've drawn a million times but you haven't ever seen, like the dorsal roots, the dorsal root ganglia, the ventral roots, and you'll be able to see those things where they come together to form a spinal nerve. You may also be able to see dorsal rami and ventral rami right where they begin. There's also some specific meningeal anatomy associated with the spinal cord that isn't well demonstrated here, but you'll be able to pick that up pretty quickly on those specimens. So it's sort of a hodgepodge day. It's in the back of the room, and we're doing a variety of brain, variety of spinal cord, and I think it'll be a good one. So we'll see you on Wednesday.